So last year on NHS Change Day, our 30 teams pledged differences that they could make as part of their team in terms of how they could influence change. So not only with the safety agenda that we've been working on, but also with changes within themselves, so for efficiency, with maybe better patient care. So every team pledged, and it was quite fun. The staff had a lot of fun doing it. The staff felt that they could actually put a pledge down, it was an anonymous pledge, and then obviously that they had a team pledge as well. So the impact of the changes for the teams was that they pledged something quite simple. The simple pledges that would make a difference to their everyday work, or it could be something to do with patient care, it could be something to do with safety. So every team had something slightly different. And our work actually was commended by Helen Bevan, and we had a visit from Helen last year to see the work that we had done within the organisation, and that was a great morale boost for the teams to actually see that their work was actually being recognised, and actually we made a difference from that and how they felt.
The thing I shall be changing for Change Day is to make nurses working in the community much more mobile and much more efficient using modern day technology. The one thing that I've noticed out there is how paper-based they are and how dependent they are in going to the office first thing in the morning to pick up their paper notes, to go out to their various visits, handwrite all their notes, and then have to go back to the office to then transpose all that back into their computer system, back in their organisation. That is completely unnecessary with modern day technology, and the opportunity exists out there today for all that to be automated so that they can have a much more efficient and enjoyable way of working.
So our action for NHS Change Day this year is actually going to be bigger and better than last year. Yeah, the Just Do It programme is obviously something that we really support our staff with and encourage them to apply into practice and develop their ideas. So we've had an initiative last year with the Dragon's Den. So we created our own Dragon's Den for theatres where staff was invited to put in applications for Just Do It ideas that they would needed help financially with some support with money to make those initiatives work. So we not only had theatre staff coming in and pledging their ideas forward, but we also had an anaesthetist and also a surgeon put forward their ideas. So that was a really good opportunity to see our teams in action about what ideas they had. One of the Just Do It ideas was regarding a patient warmer, that the portering team came up with that idea to have blankets warm for when patients came to theatre reception, and all we needed was actually a warmer to be able to warm the blankets up. Quite a simple idea, but very effective, because obviously we don't want patients going to theatre being cold beforehand. So that was just part of that initiative really.
I think if it became more of an attempt by the health service to encourage people to think about their own contribution to their own health rather than what they think about the health service, that would be a step forward.
I think more effort needs to be made around acting on the pledges. People are very reflective and very keen, genuinely keen to improve the services, the products, the culture of where they work. And now I think more emphasis needs to be placed on the actions, so we actually see this initiative yields positive results.